the video is going to cover an abdominal surgical clip and prep for a male patient.
อันนี้เป็นการเตรียมตัวสับเดี๋ยวการเตรียมตัวคุณกับเตรียมตัวของไม่มีเตรียมตัวของจะมีนิดหน่อยเตรียมตัวคุณเดี๋ยวเราสอนทีหลังเดี๋ยวให้ดูวิดีโอนี้ก่อนให้เตรียมตัวสับที่ถูกต้องก็จะมีสองรูปแบบที่เปิดท้องหรือว่าต้องบอกว่าแล้วแต่กับพวกที่เป็นระยะคือแขนขาแล้วก็จะมีสองแบบพูดไม่ถึง5 นาทีจะหลับเดี๋ยวออกมาเป็นนางแบบในขั้นต่อไปออกมาเป็นนางแบบเดี๋ยวจะหาในแบบด้วยใครหลับเราเป็นนางแบบ
First, I want to talk about the importance of wearing an apron. This will cover your scrubs and keep the hair off of the scrubs because you're going to be wearing those into the surgery suite. For the purpose of this video, however, I will not be wearing one because it's interfering with the camera. So this is an important thing to remember, however. You're going to need clippers, and they should have a size 40 blade on them. Those are surgical size clippers. Clips the hair very close to the teeth. Proper way to hold your clippers are like a pencil. They should rest comfortably in your hand like this. Holding clippers like this is really not proper because it's too easy to tip the teeth against the skin. Holding it this way, you'll have the blade of your clippers parallel along the skin, and that way the teeth here do not dig into the skin and give clipper burn. For an abdominal surgery, we will be clipping from xiphoid to pubis. On your male patient, you will stop just cranial to the scrotum. On the lateral edges, you'll go about 1 to 2 inches lateral to the nipples of your patient. It may vary depending on your procedure and how large your patient is. So use common sense. The other points are to make it a geometrical shape and edges even because the client basically sees what's done on the outside of the dog and not the procedure done on the inside. They don't have any other thing to judge it by. Some people may prefer to clip against the grain of the hair. It doesn't really matter as long as the final product, which is where your incision is going to be made, is as short as possible to the skin. You can trim any hairs that are in the field a little bit shorter, especially if you have a long-haired dog like a Malamute or curly-coated like a poodle. And that way you can keep your surgical site clean of any hair. I'm going to switch hands here so that I can go against the grain and get really close. It can be difficult sometimes because the hair will grow in all directions on some dogs. Now I'm going to start flipping down, further down on the abdomen. I am going to clip as far down. You want to make sure that where the incision will do.
อันนี้ก็คือเรียบร้อย
Once you think that most of the hair is removed from your patient, you can pick up any of this, the gross amount, and just toss it in the waste bin, and then vacuum the rest. When you vacuum your patient, it's important to remember to vacuum all the hair on your patient, everywhere in your surgical field. You may need to go above and below if there's hair pieces that have gotten elsewhere. You also need to vacuum around your patient on the whatever padding they're on or material that they're on, because hair will stick to that and could possibly get into your prep site after you've prepped it. You can vacuum yourself if you have a lot of hair on yourself. Don't forget to vacuum around the floor. It's a lot easier to clean up as you go than afterwards.
สรุปก็คือหลังจากที่ตัดขนเสร็จเรียบร้อยปุ๊บต้องเก็บขนออกให้หมดดีที่สุดก็คือใช้ได้ดูดฝุ่นนี่แหละดูดออกปุ๊บเสร็จขนต่างๆคนที่เราตัดเพราะเป็นซอสแล้วก็เป็นเรชั่นที่ทางที่ดีที่สุดคือต้องดูดออกให้หมดเดี๋ยวเขาจะสอนวิธีการเช็ดให้ดูการทำ
Some of the vacuums have an extremely strong suction on them. In that case, you need to take care when you're vacuuming around areas such as the penis or the scrotum. You can cup your hand around the end to try and vary the strength of the vacuum, but you want to be very careful and considerate of your patient when you're vacuuming. There are some areas where the hair is still a little long, so I can go over that with my clippers and try and get them very short. For male patients, for abdominal surgery, since the prepuce is going to be in the surgical field, it will be necessary to flush the prepuce with a solution of betadine solution diluted with some sterile saline. The flush for the prepuce is a solution of diluted betadine solution, and it's often diluted with sterile saline. You can use anywhere from 3 to 10 mLs depending on the size of your animal. I have a 5 cc syringe for this beagle. What you're going to do with this solution is to just insert the tip of your syringe right into the prepuce and flush into it. This will remove the gross contaminants that live in this area. Take a diaper or some other type of cloth and just squeeze out the solution that you syringed into the prepuce. And again, since this is going to be your sterile field, this is an important step to remember. You can repeat this a couple times or as many times necessary for you to feel that you have a clean or semi-clean area here. There's a couple different type of products you can use for your surgical scrubs. They both have a detergent component in them. The most common is betadine scrub. It's the yellow stuff. The other oftentimes seen product is chlorhexidine. There are a lot of different trade names, but they should be chlorhexidine gluconate. It's important when you are refilling your prep containers that you refill them with a scrub type of product versus a solution product. Both betadine scrub and solution look similar. So check your containers. Okay, so to begin the rough prep portion of your abdominal surgery prep, you'll need betadine scrub, gauze sponges saturated with betadine scrub, and gauze sponges saturated with alcohol. You'll want to begin kind of where your incision site is going to be. I'm right-handed. And you're going to go in kind of a elliptical pattern, radiating outwards towards the edges of your surgery site. It's important, once the gauze touches hair, that you toss it and get a new piece, since the hair is the contaminated part of the patient. You should also not retrace your steps. If you need to get a new piece of gauze, you can. It's better to use more than not enough. For this edge here, I'm going to just go back and forth because I've already scrubbed at the edges of my lateral side of the field. But notice how I'm always moving away from the surgical site. You can begin your rough prep with either alcohol or betadine solution. It kind of depends on personal preference. There's probably many reasons for doing one versus the other. This is just one way that's acceptable that you can do for your prep. You want to do a minimum of 3 alternating betadine and alcohol. You may need to do more alternating the betadine scrub and alcohol if you're
สรุปเวลาที่ทำเนี่ยถ้าอยู่กับตำแหน่งผ่าตัดเนี่ยหรือว่าผ่าช่องท้องเนี่ยเราจะเริ่มจากจุดที่เป็นแนวผ่าตัดก่อนเสมอนั่นคือจุดเริ่มต้นจุดแรกแล้วก็วนคุณจะทำแบบไหนก็ได้จะเป็นแนวตรงก็ได้หรือจะค่อยวนแบบเขาก็ได้เมื่อสำลีหรือว่ากอสที่เราใช้เป็นกอสมาก่อนสัมผัสกับคนหรือเป็นจุดสิ้นสุดก็คือไม่ต้องทำต่อที่เหลือที่อยู่ใกล้ขนเนี่ยเช็ดออกจะไม่วนแล้วเช็ดออก4 มุมเห็นไหมเดี๋ยวเราทำซ้ำอีกทีหนึ่งอันนี้เป็นขั้นตอนแรกจริงๆแล้วขั้นตอนก่อนการผ่าตัดเนี่ยเราต้องใช้สไลด์เสร็จอีกทีที่เป็นอุปกรณ์เนี่ยก็เป็นอุปกรณ์สไลด์ทั้งหมดก่อนการลอง
Patient is particularly dirty. 4x4 and just pick up the hair with it like that and toss it. But that way you don't contaminate your site. Your last piece of gauze, alcohol gauze, you can hold it up and be able to see that there's no dirt or even betadine on there. Now your patient is ready to be moved into the surgical suite where you will finish with a final surgical scrub and a final prep. Now that we've moved the patient into surgery, you can begin your final scrub. Since we're in the surgery suite, we've got our cap and mask on, the apron has been removed, and we are also not wearing a white lab coat. The final scrub is done with the same technique as the rough scrub. We'll just use the containers that are in surgery. I removed my mask for purposes of this video, but we are in the surgical suite. The final scrub has been completed, and we are now going to apply a final prep. We're going to be using a sterile prep set. So we'll open the sterility.